Hi, welcome to Marine Gurukul video series. In this video, we shall try and take you through some questions on exit exam related to MFA refresher course. Okay, first one, which out of the below is not a symptom of heart attack? Chest pain, red, hot and dry skin, pale and pale or bluish in color, profuse sweating. Obviously, the answer here is red, hot or dry skin is not a symptom of heart attack because chest pain, pale or bluish color or profuse sweating are all symptoms of heart attack. Your check of the scene suggests that a victim has suffered an electrical shock. The first thing to do is cover all burns with dry loose dressing. Ask a bystander to help or move the victim. Place the victim on one side with head down. And lastly, make sure the power is turned off. Obviously, the answer is D. Make sure the power is turned off first before you do anything else. When performing adult CPR, you give 2 slow breaths with 15 chest compressions, 1 slow breath with 10 chest compressions, 5 slow breaths with 10 chest compressions, and or 3 slow breaths with 15 chest compressions. I'm sure you know the answer. The answer is 2 slow breaths with 15 chest compressions is what you do when you perform adult CPR. Why should you cover burns with clean or sterile dressing? To prevent infection, to cool burnt area, to keep the burned area warm, both A and C. Obviously, I'm sure you know the answer. The answer is to prevent infection. The burns are covered to prevent infection. You are caring for a victim with burnt hand. Put the hand in cool water. If the burns are very deep, there are burns with open blisters. The burns are minor with no open blisters. You should put the hand in cool water for all of the above. Obviously, the answer is that if there is a victim with burnt hand, we must try and put his hand in cool water. In general, a splint should be loose so that victim can still move the injured limb, snug but not so tight that it slows circulation, tied with davits over the injured area, none of the above. Well, the purpose of the splint is to immobilize the limb, so it should be snug but not so tight that it slows down the circulation. Where is the carotid artery located? Inside the wrist, just above the hand, on the neck to the right or left of windpipe, behind the kneecap, inside the arm between the elbow and the shoulder. Obviously, the answer is on the neck to the left or right of the windpipe. A victim has lost a lot of blood through a deep cut in his leg. He is breathing fast and seems pale and restless. He is probably having a stroke, having a heart attack, he is in shock, or he is choking. Answer is because of the blood loss, he probably is in shock. Which would you do when caring for a seizure victim? Remove nearby objects that might cause injury. Place a small object such as a rolled up piece of cloth between the victim's teeth. Try to hold the victim still. All of the above. The answer is remove nearby objects that might cause injury to the victim. A burn should be immersed or placed under the cold water for at least 5 minutes, 10 minutes, 15 minutes, or 20 minutes. Obviously, the answer is a burn should be placed under water for 10 minutes. Splint, an injury to a muscle, bone, or joint. That means when should we use the splint? You must move or transport the victim. You can do so without hurting the victim. You have splinting material available, both A and B. Answer obviously is A and B when you need to transport the victim, and you can use the splint without hurting the victim. A crew member has just splashed a chemical on his face. You would cover the burned area, have the victim stay calm until help arrives, flush the burnt area with large amounts of water, immediately ask for medical evacuation. Obviously, the answer is flush the burnt area with large amount of water. In order to assess for a pulse of an adult crew, you would assess it for how long? Carotid pulse for at least 5 seconds, but no more than 10 seconds. Carotid pulse for 10 to 12 seconds. Femoral pulse for at least 5 seconds, but no more than 10 seconds. And last is none of the above. The answer is you need to assess the pulse of an adult group before you pronounce any decision, and that has to be carotid pulse for at least 5 seconds, but no more than 10 seconds. So carotid pulse has to be assessed for 5 to 10 seconds. You find a person at the bottom of the stairs. He appears to have fallen and seems badly hurt. After sending someone for help, you would roll the victim onto the stomach, keeping the head and back in a straight line. Roll the victim onto one side. Position the victim onto one side. Attempt to keep the victim from moving. Now, since the person has fallen, the person may have suffered some fractures. So your attempt should be to keep the victim or avoid the victim from moving. Shock is the body's response to blood loss, emotional distress, severe allergic reaction, all of the above. Obviously, shock is the body's response to excessive blood loss. A victim has a large piece of glass sticking out of his leg. You should leave the glass in leg and control bleeding. Call for further assistance. Remove the glass and then control bleeding, both A and B. Obviously, the answer in this case is A and B. You shall leave the glass and try and control bleeding. At the same time, you should seek assistance. The ABC rules are an important part of first aiders. What does the first aid ABC rule stand for? Airway, breathing, circulation, in that order. Airway, circulation, breathing. Breathing, circulation, airway. Circulation, airway, breathing. Obviously, the answer is A, B, C. So it's airway, breathing, circulation. Which of the following should be done for a person experiencing a heat-related illness? Keep the victim warm, force the victim to drink fluids, apply cool, wet clothes, place the victim in warm water. Obviously, the answer is apply cool, wet clothes because the person is experiencing a heat-related illness. A conscious casualty is choking. After advising the casualty to cough and assuming that has not worked, what should you do the next? Try to hook the object out of the mouth, call for help, attempt up to 5 back slaps, attempt up to 5 abdominal thrusts. Obviously, the answer is attempt up to 5 abdominal thrusts because the conscious casualty is getting choked. So once you try abdominal thrusts, there is a possibility that the material causing the choking may be thrown out. Which of the following is not a reason why we put unconscious casualties in recovery position? It is safe and comfortable position to get blood back to brain. It allows the tongue to fall forward. If they vomit, it drains out rather than choking them. Obviously, why we do not put an unconscious casualty in the recovery position is to get the blood back to the brain. You feel a sudden sharp pain in the bottom of your left foot. You look at the bottom of your left shoe and see a tag sticking in your shoe. What type of wound do you probably have? Avulsion, bruise, scrape, or puncture? In such cases, what you expect is a wound which is puncture in nature. Which should be part of your care for a severely bleeding open wound? Allow the wound to bleed in order to minimize infection. Apply direct pressure and elevate the injured area if no broken bones. Use a tourniquet to stop the blood flow. And lastly, both B and C. Obviously, the answer in this case is apply direct pressure and also to elevate the injured area so that the bleeding could be contained. A wound where there is damage to the soft tissue and blood vessels under the skin is called a scrape, a cut, a bruise, or an avulsion. The answer obviously is a bruise. Which of the following behaviors reduce your risk for injury? Always wearing a safety belt, limiting intake of alcohol, limiting intake of foods high in cholesterol, and both A and B. Obviously, if we wear a safety belt and we limit our intake of alcohol, we'll reduce the risk of injury. So the answer is both A and B. Which is the first step when caring for bleeding wounds? Apply direct pressure with clean or sterile dressing. Apply pressure at the pressure point. Add bulky dressing to reinforce blood-soaked bandages and elevate the wound. Obviously, the correct answer is apply direct pressure with a clean or sterile dressing. How can you reduce the risk of disease transmission when caring for open bleeding wounds? Wash your hands immediately after giving care. Avoid direct contact with blood. Use protective barriers such as gloves or plastic wrap, and all of the above. Well, if we see all these reasons, they all would help in transmission of disease. So the answer would be all of the above: washing of your hands, avoiding direct contact, and protective barriers. You have tried to control a victim's bleeding with direct pressure and elevation, but the bleeding doesn't stop. Where would you apply the pressure to slow the flow of blood to a wound on the forearm? Outside the arm, midway between the shoulder and the elbow, on the inside of the elbow, inside of arm between the shoulder and the elbow, and any of the above will slow the flow of the blood. And the answer is inside the arm between the shoulder and the elbow. It's at that area, in that area, if you apply the pressure, you can contain the bleeding. Dressing and bandages are used to reduce the victim's pain, reduce the internal bleeding, help control bleeding and prevent infection, make it easier to take the victim to the hospital. So obviously dressings and bandages help in control of bleeding, and more importantly, they prevent infection. Most injuries are due to situations that you have no control over or could not have been prevented. You have some control over and could have been prevented. Involve five or more people. Involve drills. Obviously, the answer is you have some control, and if you're careful and cautious, the injuries could have been prevented. Thank you for watching these questions on exit exam for MFA refresher. We hope they have given you some insight into type of questions that could be asked. We shall endeavor to put more such sets. So the more the sets you watch, better would be the chances of your being able to be comfortable during the exit exam. Thank you for watching Marine Gurukul video series. Thank you very much.